All right, thanks, Ashley. Well, prostate cancer is the most commonly diagnosed cancer in men in the U.S., and like many other cancers, early detection is the key. Here to talk more about prostate cancer and the importance of screening is Dr. Evan Shreck, a urologist at Hartford HealthCare's Tallwood Urology and Kidney Institute. Doctor, welcome.
Thank you very much for having me.
Thanks for being here. So what are some of the signs and symptoms of prostate cancer that would lead a man to see a specialist?
So the prostate is part of the male reproductive system. It's located just below the bladder in males and surrounds the urethra, which is the channel that empties urine from the bladder. The prostate normally produces fluid that makes up a portion of the semen. And prostate cancer is actually the most commonly diagnosed cancer in men in the United States. Over 170,000 men are diagnosed with prostate cancer yearly. Over 60% of new cases are diagnosed in men aged 60 years and older, with the average age at diagnosis of 67 years old. Prostate cancer is often a silent disease and typically does not present with signs and symptoms in patients. It's usually diagnosed by screening tests that we typically perform.
All right, doctor, at what age should men start getting screened for prostate cancer?
The American Urologic Association recommends PSA screening between men ages 55 to 69 years old. It is important to have a discussion with your urologist regarding the risks and benefits of this blood test. Certain patients may be at higher risk for prostate cancer, especially if there's a strong family history of prostate cancer, and may undergo screening prior to the age of 55.
All right, tell us exactly what is a PSA test and what is the PSA test recommended for prostate cancer screening?
So PSA stands for prostate-specific antigen. It is a reproductive protein that's produced by the prostate. Normally, blood levels of PSA are typically low. PSA levels can increase in patients who have prostate cancer. However, PSA can also be elevated with benign conditions such as infection, inflammation, or trauma to the prostate. Because of this, PSA is a screening tool and does not effectively diagnose prostate cancer.
All right, what should men expect from their results?
So as mentioned above, the PSA can be elevated for a number of reasons, including benign causes as well as prostate cancer. Oftentimes, if the PSA is elevated, there are other studies that we can perform. There are other blood tests and imaging, including MRI of the prostate, that can give us more information as to whether the PSA is elevated due to a benign or malignant reason. These tools are often discussed as a shared decision-making between the patient and the urologist. Ultimately, in order to diagnose prostate cancer, a biopsy of the prostate can be performed. This allows the pathologist to look at the samples from the prostate to determine if cancer is actually present in the prostate.
All right, Dr. Evan Shreck, thank you so much for joining us. Great information.
Thank you for having me.